Hello, this short training will walk you through how to use the sepsis screening tool on Hive to risk assess a patient you suspect has sepsis. It will also show you how to use the Hive tools to effectively manage a sepsis patient. There are various ways to access the sepsis screening tool. The first example of this is based off a patient with a raised early warning score. In this example, the patient has an EWS of 7 or more, and so a red OPA is generated to alert you to consider the sepsis screening tool. Simply click on the sepsis link to be navigated to the Sepsis Navigator page. Similarly, if a patient has an EWS of 5 or 6, an orange OPA will appear, again prompting you to consider screening your patient for sepsis. If your patient does not have a raised EWS, you are still able to access the Sepsis Navigator at any time. Select the Sepsis tab from the drop-down arrow in the top right corner of your screen. You can also pin sepsis so this will be available in your tabs to be accessible for the future. You can also access the sepsis screen through the triage tab. Once you click the sepsis tab, the sepsis navigator will appear. Here you will see, for each element of the sepsis checklist there are prompts, information and guidance available to deliver gold standard care. Next, you will need to select the sepsis timer in the left-hand options. Click New Reading under the Sepsis Screening tab. Now you need to work through the screening questions by selecting the relevant options for the patient. The first set of options are based on risk factors for the patient. If the patient had observations taken within the last 2 hours, Hive will automatically identify if their EWS has triggered and highlight the relevant boxes for you. In this example, the patient had an EWS of 7 or more and therefore triggers for high-risk sepsis and the timer needs to be started. In this example, you can see the EWS is triggered. The patient has an EWS of 5 to 6 and you can now consider if there are any additional risk factors. This can make a big difference in the outcome of the screening tool. If there are no additional risk factors, the patient will be moderate risk for sepsis. If there are additional risk factors, the patient would be higher risk for sepsis. So it is important for you to pay attention to the risk factor questions as it can impact care. Lastly, you can see it will ask you, do you want to start the sepsis timer now? If you suspect sepsis, ensure you click yes. Starting the timer is essential for the effective management of sepsis, as you will see in the next slides. Once you tick yes to start the sepsis timer, the sepsis banners will appear in the sidebar summary in red, and the timer will begin counting. Hive will automatically identify which of the actions have been completed. For example, when you did a set of observations on your patient, you noticed they were desaturating, so you applied and documented oxygen delivery. The banner for oxygen has now been changed from red to green automatically. Any actions already done will show as complete. To save you time, the banners are interactive, helping navigate where you need to go within Hive. By selecting the banner, it will navigate you to the relevant area to complete the action. For example, if you select antibiotics, you will be navigated to the MAR to review and administer. Once all actions are complete, the timer will automatically end. You can also manually end the timer if needed. Once the sepsis 6 actions are complete, the banners will appear in green and the timer will end. Not all patients require the full checklist for various reasons. In the left-hand side of the Sepsis Navigator, there is a Treatment Exemption tab. Here, you can document any variances in care. Some elements of the checklist may not be clinically indicated, such as IV fluids. If your patient is hemodynamically stable and does not have a raised lactate, they do not require IV fluids, so you can click the box Not Clinically Indicated. The Not Clinically Indicated option will also change the banners from red to green. Another scenario is the patient does require IV fluids, however, you are unable to gain IV access or unable to complete for some other reason. In this scenario, click the relevant box and make any necessary comments. These options will not change the banners from red to green as they still require action, but your documentation of the delays provide clear evidence of the situation and any escalation strategies you have made. Once the actions have been complete and the timer has ended, the banners automatically change from green back to red. This is a reset mode to ensure the banners are available to use should the patient trigger for sepsis again. As you can see, however, the timer has completed, so you can be assured the tasks you have been achieving are reflected appropriately. If the patient is moderate risk, no banners will appear in the sidebar. Instead, you will complete the moderate risk sepsis checklist. Once this section is complete, you can manually end the timer. This brings us to the end of the training. A key take-home message is if you suspect sepsis, it is important to use a sepsis screening tool to risk stratify your patient appropriately. Failure to do this could have an impact on care delivery. The sepsis management tools are there to support you in practice, to remember and to keep track of the tasks and time, essential for quality sepsis care. Thank you for listening.